Over to Mrs. Rama.
Ma'am,
Good afternoon. Today's speaker and eminent researcher Dr. Maithili Hazarika, Associate Professor in Clinical Psychology, Guwahati Medical College and Hospital. Dr. Maithili had pursued her degree and master's from Ferguson College and University of Pune with distinction. She had completed her MPhil in Clinical Psychology from National Institute of Mental Health and Neurosciences, India. She had pursued her research in psychology towards fulfillment of PhD degree from University of Guwahati in 2012. She had also worked on her postdoctoral research training for 1 year in University of Florida, USA on the topic neuropsychology and drug abuse in the year 2016. Dr. Maithili had been into the medical service from 2000. She was clinical psychologist in Assam Medical College and later senior lecturer in clinical psychology at Guwahati Medical College. She is an active member of the editorial board of a peer-reviewed Open Journal of Psychiatry and Allied Sciences and present reviewer of National Tobacco Control Program, Government of Assam. He is also reviewer and examiner of psychology and sociology courses of Guwahati Medical College and supervisor of master's degree interns from all over India. She is a member of many prestigious organizations, to name a few: Indian Psychiatric Society, Assam State Branch, Steering Committee member of the National Tobacco Control Program, Government of Assam, and State Level Monitoring Committee member of Cable Television Network under Information and Public Relations Department, Government of Assam. Core member of the Prevention and Intervention of Burn Victims Society, Sneha Bandhan, and mental health expert consultant in Udayachal, a special school for differently disabled children. Her contributions to science is exceptional. She has 37 publications in national and international journals. Dr. Maithili had pursued Fogarty Fellowship for Non-Communicable Diseases in University of Florida and also at National Institute of Mental Health and Neurosciences. Represented as a delegate of UNICEF for child abuse for multidisciplinary professionals. She was a guest speaker for more than 100 seminars, 66 workshops, and on television and radio had disseminated information about the importance of mental health problems, prevention, early identification, and treatment among the mass for over a decade in Assam. Her talks have focused on various psychotherapeutic practices, stress reduction techniques in various government and non-government institutions. She is involved in various community developmental projects in the area of mental health and has a family trust in the memory of her late father, namely Patan Hazarika Charitable Trust, and one of the primary objectives of this trust is awareness and intervention programs on health and social issues. She is presently engaged in two funded and two self-funded research projects on substance abuse, neurocognitive functions across lifespan perspective and mental health of young children. Little Flower Degree College welcomes you, ma'am.
Thank you, Mrs. Rama. May I request Dr. Maithili Hazarika to take over the session on COVID-19 pandemic and its multidimensional impact across dimensions. I request the technical team to enable her to share the screen. Over to Dr. Maithili Hazarika.
Uh, Thank you very much. Am I audible to everyone here?
Yes, ma'am.
All right. So a very good afternoon. And after an elaborate introduction by Mrs. Rama Devi, I think people know me very well. But yeah, I'm doing my part from this part of the world as much as I can. And I definitely would like to thank the organizers, especially Dr. Gomati, for all the time being behind me and setting up dates and the time and the topics and all. Dr. Gomati, I'm very, very happy that I could make it and all of us are here today. And it's a delight. Mr. Vincent Reddy is the principal of Little Flower Degree College, and also Dr. Devabrot Khanikor. He is very dear to me. He's from Sonapur College, a principal. I'm very happy to be here, sir. Thank you very much for having invited me to be a speaker in such a very, very technical and educative as well as an academic seminar and a webinar at national level. Thank you very much. And Dr. Virinchi Sharma, he had given a very, very elaborate introduction about what is anxiety, what is stress, and from all the different perspectives. And so I would definitely like to go ahead with some of my work that I have done so far in medical college as well as in our Assam at this point of time. I'm Maithili, as people know me by now, and I would like to go through certain things that we had done in this part of the world. Like mental health, as we all know, matters a lot, and this pandemic has created a lot of trouble in our mind as well as our inner body. So what happened to me is, like, in last 2.5 months, I myself had gone through quarantine for my daughter who had come from Delhi, and I had to keep her secluded, and we had to be inside home. I couldn't go for work. And during that time, I realized the kind of telepsychological counseling that was so very important in order to address the mental health needs at this point of time. So what happened is I started writing basic guidelines and published it also. And it's the first time from this part of the world, there is one guideline on pandemic that has been published, and that is the only guideline during this pandemic. So we had worked for 15, 20 days and published it. And after that, I wanted to do telepsychology counseling. And the government, basically the Assam police, came forward and gave us 6 helplines. And with the 6 helplines, we, the clinical psychologists, all our trained clinical psychologists, we started, running the helpline and got some kind of problems in mental health in different kind of people in this part of the world. And I'm just now trying to show you what are the different kind of issues that they came up with. The panic and anxiety regarding COVID was very high among this, and this is going to be published. I have sent it for publications. It's on the way. Lockdown worries were very high among this population, depression, as he had already mentioned. And also there was some need for guidance about what is COVID, what are the different misconceptions, what are the different myths about COVID. And we have also seen that the past illness of psychiatric illnesses that is there in a person got really relapsed during this phase, because there was lack of medicines, as well as people could not actually access to mental health care. And there was this fear of loss of job and rise of domestic violence, which I'm going to talk in detail, what we did and how we approached those people while doing telepsychology counseling. So the teenage issues was very high, and some people had written here that what are we going to do with children who are in the net. I'm going to talk about that a little bit late. There are these migrants issues that is really going to be huge now, because the finances will take a toll on people, and there will be a lot of depression, case of depression, as well as you can see the rates of suicide these days. There were people who had called us up for e-pass inquiries, like how will they come from one place to another. People from Hyderabad had called us saying that we are stuck in Hyderabad and now how to come home. We are we are from Assam, we are from Manipur, we are from Shillong, and guide us how to come. And these were the calls that we used to get. There was definite increase in behavior addiction. That is one thing that we mental health professionals need to be very, very cautious, because the screen time management, how much time we can give to a child to be in the gadget, and that has to be streamlined. Otherwise, again, the new internet addiction or the behavior addiction will set in, and it will be very, very difficult to control. So the post-traumatic stress, if you can go through the research in Ebola and Nipah virus and other viruses that had happened, HIV, AIDS, and so many things in the past, we can see even swine flu and all, swine flu. So what happened was, during those kind of pandemics and different kind of stress that had happened in the society in earlier days, there was post-traumatic stress disorder later on. Afterwards, when people used to assess the mental health of people, we found a lot of PTSD cases, acute stress reactions, and grief issues, basically. We got cases where people had lost their dear ones, and how to resolve the grief over the telephone was not very easy for us. So I'm going to definitely talk about those case studies at this point of time. So this is, there are 3 case studies that I want to discuss with you people. And we did a very, very comprehensive management of these series of cases. I have sent this for publication. It is not yet published. It's on the review, status. So this is a young woman. She is around 20-year-old female. All right. So what happened? The Deputy Commissioner of Assam Rural, Mr. Kailash Karthik, he called me up one day and he said that, Madam, this is a lady who is, hospitalized. She is in isolation and she is in extreme stress and she is crying and nobody is being able to console her. And she is in the hospital, the quarantine hospital, the COVID hospital that we have in Guwahati, Guwahati Medical College. Then then I was like, all right, so what do I have to do? Then you just have to give a call and find out her mental status. Immediately, I called her up and, I talked to her and I came to know that she's a student of master's degree and she had come from Bangalore and she was found to be COVID positive. And she was in the isolation ward. I don't know what happened to this. Mm, yeah. Is it okay?
Yes, ma'am.
Oh, yeah.
Okay,
So,
yeah.
all right. So I can control the slides from here also, right?
Yeah, ma'am. You can control it, ma'am.
Yeah. So this was this case. Then when I talked to her, then I came to know that she had adjustment disorder. Adjustment disorder is something to do with her, event in life. When you cannot adjust to a new negative event that has happened in your life, you just cannot cope up with the stress. So in her case, she could not adjust to the new hospital environment. She just came from Bangalore with her parents and she was very shocked. She just asked me that, Madam, my parents were with me, my brother was with me, everybody was with me, but nobody was COVID positive. Why me? I mean to say, I didn't go anywhere, I didn't do anything, but I am COVID positive. Are the results true? Or I think it's false, and how do I cope with this? And she was like, I think it's better for me to die rather than live with COVID and those kind of symptoms. Then I really had to pacify her. Then I asked her, what is your main issue? What is it that you're so distressed about? Then she said, no, because I think I'm going to die, the kind of report that I see. Then I had to give her education about what is COVID and how does it pass and what happens, and the rate of death all over the world is so less. So different kind of mechanisms I had to use. At first, I had to really pacify her. You did some grounding exercise. That please sit down. Where are you? Do you have anybody around you? Have a glass of water. And then she had a glass of water. And I did deep breathing exercise with her. Like take a deep breath. Breathe in and breathe out and talk soft. Don't have to be so loud and shrilling and all. It's okay. Just normalize yourself. Everything will be fine. And in that way, I had to compose her because she was like on top of her voice crying. Then at that point of time, I said that everything is fine. Do not worry. We are all there. The doctors are there. Your parents and you are away from them only because of the transmission of this disease. Because it should not be that being in the hospital, you're doing a lot of good work because you're making the whole society safe, because the transmission process of this disease happens very fast. And because of that, of the safety side, because of the safety issue, you are kept in the hospital for a few days and you'll definitely be out of this hospital because it's just an infection and you'll be fine. And in that way, when I was talking to her, she was pacified and she could sleep that night. Next day, I called her up and I asked her how she and was she eating, could she sleep well, and what about her exams. And she started talking to me about her exams, her books and all. Then I spoke to the center head to get her books to that isolation center, and they did it and started studying also. And she did her deep breathing exercises and some kind of mindfulness training, which Dr. Virinchi had said about being in the moment and being now and here. So in that way, I had to really pacify her over the telephone when we did everyday session with her. This is another lady that the second case was a case of a 23-year-old lady who had come to our outpatient department in Guwahati Medical College. She came with a lot of aches and pains. She said that I am having stomach ache and I am having all the different kind of tingling sensation in my whole body and I can't sleep, and a lot of physical symptoms. And then she said, I have a major disease, doctor. I think I have got COVID. Then people had asked her, like, how did you get this illness? How do you think that you've got COVID? Then she said, because I have a travel history. I have come from a place called Borpeta, which is in Lower Assam. And she said, there are 2 cases in Borpeta that has been found. And I think I have, gained that, infected by them. then I had to ask her, like, how far were you? Did you meet those people? Were you in contact with those people? Because are you a secondary contact, if not a primary, or the primary contact? And she said, no, I just know that they are from Kolkata and I have come from Kolkata. So I think I have got it. And she had this deluded kind of a belief. Nobody could, make her understand that this is just not, this just cannot happen. And this is hypochondriacal because you're thinking a lot that you have a disease, but actually you don't, because your tests are negative, you don't have any symptoms of COVID. And she said, no, I have symptoms of COVID. I have a cooling sensation in my whole body. I just can't stay still. And I think I'm coughing also, doctor. And then I really had to, make her understand. But still, when we could not, she was given medication. And we said, okay, with medication, she will be finally a little bit stabilized. And after that, probably we can see her again. Then we called her again after about 7 days. And by the time she was a little bit stable with her physical symptoms with medication, that is anti-anxiolytics that people give at the psychiatrist. This was a case of, hypochondriacal with anxiety and depression, because she had no mood, she was not, eating, and she was fatigued, she had no interest in anything in life. So that those were depressive symptoms. Then there's another lady who was 37-year-old married woman, and she was a homemaker. And the neighbors used to tell her that, she's got COVID. And then when I asked her, why did the neighbors say that you had COVID? Then they said that because I had fever, and that fever actually lasted for a long time. And subsequently, I had a lot of, symptoms of my respiration. And I am like quite rigid in my way of thinking. And she was very rigid also in her way of thinking. And she said, because of these, I have contracted COVID. Then I said, are you sure? Then she said, yeah, I am very sure, because I know myself. And I think, COVID is in me, and please, doctor, keep me here. I don't want to go home, because from me, my family will get COVID, and from my family, the neighbors will get COVID. Then this was another case that we had to deal. And we had to ask her, like, what help does she want from us? And she said, no, I want to get admitted in the hospital. That these are the different kind of cases that we had caught during this phase. And these two people, at second and third, we had done psychotherapy in our OPD basis. And the first case was done on telepsychology counseling. So I mean to say, the kind of panic that we had come across during this telephone counseling as well as face-to-face counseling is significant. And there was one online study that we did in the first initial 2 months. Rapidly, I started giving survey to people. The aim of the study was to explore the psychological impact of COVID-19 during the initial period in the general public of India. Because we have all the data from US, China and all, but we didn't have any data from India. But when I did this, there were a lot of people around, 600 and some recipients and the respondents, and from there we could analyze around 465 people, I guess. And we saw that the depression, anxiety and stress level was very high. SD was 23.36, but 36% were depressed, 32% was anxious, and 31% was stressed. And most respondents were young adults, women, single, and middle socioeconomic status, urban locality, and they were students. And it was very amazing to see that and the rate of depression among India was not very different from US. As he had already said, it was 36% in the US. So here also it was around 35 to 36%. So you can see that the stress and depression and anxiety is equal across the globe. It is not only the US, it's in India, in China, and China also it was like a similar kind of a report from 25 to 36%. So then what we did was, in this telepsychology study that I had done, and this was done, I told you in the initially that Assam police had provided us with 6 helplines, and from 7th April to 24th April, there were 239 people who had called us. And from there, that is in Assam, okay, entire Northeast. Some people were from Bhutan and even from South India, from Mumbai and all. And these are Assamese people who are in different parts of the country and also in different countries like Bhutan and Nepal. These were the 2 countries that they had called us from. So we saw 23% were having symptoms of depression, and we had, 10% had anxiety spectrum disorder, and 46% had anxious preoccupation and worry about the lockdown and the uncertainty. So they were very uncertain, and so 46% had anxious preoccupation. When will the lockdown come to an end? What is going to happen tomorrow? Will it end? And if it ends, is it going to be this year, or when is it going to happen? That was because of uncertainty in people's mind. So there were 13 callers who had expressed death wish and suicidal ideation, and they needed emergency help and medicines due to earlier interpersonal conflicts, which got exacerbated during the period of lockdown. Why I want to focus on this is because I'm going to talk about domestic violence definitely, but what is important for all of us to understand here is that somebody had asked in the chat that what about the suicide? What about people who have major issues about depression? If they want to die, how are you going to deal with that? At this point of time, when you feel that a person is an emergency, you have to definitely treat the same as an emergency. Immediate hospitalization, immediately contacting the family members, immediately, taking some measures to curb that kind of status is very, very important ethically. Medicines will be required, probably sometimes ECT is given for suicide, ideation, and immediately somebody has to be roped in. I mean to say, even if he says confidentially, because I don't want to know, I don't want to tell anybody else, but as a clinician, you have to take the family members' names or the police, 100, you have to dial and give the address of this patient and deal this patient as an emergency. So the psychological impact is huge, as you have seen all over, and regardless of the exposure. I'm not talking about people who are exposed to COVID-19 pandemic, even people, who are the family members and who are secondary and tertiary, even if they do not contact with any kind of COVID patients, are in anxiety state and very fearful, and they blame people for, blame religion, blame the society, blame certain kind of races, blame, they give virus name as Wuhan virus or Chinese virus, and all those are stigma related issues are also coming up. The psychiatric morbidity, I'm not going to talk so much about that because people already know, and Dr. Virinchi had already talked about all these issues very much in detail. But what I want to say is about, the grieving process. Why does a person grieve so much, and what happens to this, the status of people when a young child or any family members dies in the whole process of COVID? Many times I have even got phone calls about anger. He's getting very angry that the person had died. Resentment. How can he just leave like this without notice? So this is something to do with, resolution of non-resolution of certain things, the unfinished business that has happened because we were not prepared for it. And suddenly this person is no more there. So it is some kind of, a kind of a dysphoric feeling that I just could not get time with this person. And he's just taken away from the health workers and he's no more with me. And it's a kind of an anger towards oneself. It's an introjected anger. And sometimes that might also lead to suicide. That, if this person had died, it's no point of me surviving in this world. So those kind of thoughts also comes to our person's mind during the status of grief. And those who are seeking quarantine, they may experience guilt and also stigma. Guilt is very high, but what I see is that a lot of people whom I have talked to over the telephone, I have found that they are very guilty of going to this place and that place. And probably they are also saying, I shouldn't have gone around, I shouldn't have met some people, probably it was a mistake on my part, and a lot of guilt. And this guilt also leads to sadness, and that might also lead to depression and suicide. So is this stress universal? Yes, this stress is universal because it is very, very uncertain. We do not know, how the transmission is taking place, and the fear of dying and death is very huge, and we are not prepared for it. It is so sudden, and lack of adequate knowledge, and people have very less knowledge. What I have seen, even people who are educated, who are very knowledgeable, who are elite class people, they also do not have the adequate knowledge about transmission, about COVID-19 virus, about the infection, which is not to be so panicked about, or not to think to be so dangerous that it can kill you if you take proper precautions and you know what you need to do. And human beings are non-adaptable. Yes, we get adapted with time. We just cannot get adapted in a magic or in a fraction of a second. And because of that, it's a lot of adjustment disorder that takes place in our human mind. And we cannot adjust to our emotions, we cannot adjust and control, and we just cannot get adjusted to a new situation that is prevailing. Then it is definite stress for us and definite anxiety for us. And we are people who are non-flexible. We are very rigid as human beings. We have a particular way of doing things. And if there's a jeopardy or there's a kind of a change, any kind of change, may it be good, positive, or negative, we cannot be flexible. So this non-flexibility also makes us very rigid and depressed, and we do not know what to do. And extremely anxious and guilt and existential anxiety. Yes, I have seen a lot of people asking about what is the meaning of life now, because I don't think there is any meaning in my life, because whatever I have studied, whatever I thought and planned for is not happening. And I really do not know whether it is going to happen or not. So this is one thing people ask. I don't see any purpose in living, ma'am. I don't think, my career is going to give me any reward tomorrow because I have chosen a career. Probably it is going to die tomorrow. A lot of teachers, even, things are becoming digitalized. Everything is so online. So people are thinking, as professionals, how much we'll be able to connect. Even psychologists ask me questions, ma'am, we always used to believe in in-person therapy. We always used to think about face-to-face counseling, because face-to-face counseling via media is different from face-to-face counseling when you are in-person counseling. And we used to sense a lot of warmth, our non-verbal communication that matters so much in counseling. What about those? We were taught that non-verbal communication is very important. Here in counseling, we will not see how the person is sitting, what is his gesture, is he fiddling, is he showing any anxiety symptoms, because we don't see him. So will this counseling help? All these different kind of issues are coming up, and people are so extremely anxious about their own professions, because people think whatever profession they are choosing is not a right profession anymore, because the world has changed and everything is going to change. So that is another existential anxiety for people thinking about depression and suicide. There is another thing is about no treatment. When something is treatable and curable, then we are okay about it. There's a vaccine, right? We can have the vaccine and we'll be all right about it. But when we know that there's no treatment, they imagine the kind of load that people will have in their mind when they get the COVID-19. They'll see that there's no treatment. So I don't know whether I'll be cured or not. So these are certain issues. So the post-pandemic mental health problems will be high, very huge. As people had already said, alcohol use, stress, depression, PTSD because of isolation, quarantine. A lot of stigma and discrimination is happening all over the world, and in India more so. And the stigma and discrimination is killing everyone. Why? Because people are not going to healthcare professionals to show themselves, because they think if tomorrow I am assessed and I'm found to be COVID-19, then probably I'll be in isolation, I'll be treated like an untouchable, and the family is going to leave me. Nobody is going to accept my dead body, even for burning and cremation. It's better for me not to show even if I have symptoms, and I let me die among my family members rather than being in an isolation. So this kind of an attitude is building up because of the stigma, because of all these issues that we are reading in the news. Even in Assam the other day, again the deputy commissioner, he spoke to me and he said, ma'am, you know what happened? I said, yes, sir. And then he said that we have to do something about the stigma and anti-stigma related issues and all. Then I was like, how can we go about it? And he said that own family members did not allow their own family member to be cremated, because they didn't want the dead body to be brought home. And he did not know, and the whole management authority, the general administration did not know what are they going to do with the dead body. And the administration in Guwahati had to take the whole responsibility on their shoulders to go and burn the dead body. I mean, to say the family refused to even take and see the dead body. This is the amount of stigma that is happening. If before death, you come to realize that you will not even be given that kind of a credence and respect after your death, and your dead body will be piled up by somebody else. Look at the mindset. The people will be so fearful to even go to show their symptoms to anybody and take help. So this is how it's going to be negative among all of us, and this is going to really be a killing status. So at the individual level, across all generations, child and adolescent issues, domestic and family issues, and the elderly population. He had given an introduction, and he has touched upon certain things. I'm going a little bit deeper into those issues. So when we talk about the child, what do we talk about? The children are developing, they need a lot of peers in their life, and they have high physical energy, and they have high need for social play. So When there's a risk of infection, when there's excessive fear of illness, where there's a disruption of normal routine, where there is a worried about the loved ones, about their parents and their grandparents having an illness and not allowing them to go to the grandparents, not allowing them to meet their neighbors, diminished care and supervision because the parents are all the time anxious and they also do not know how to manage their work and home and all those issues, then definitely there is a high level of stress on the children. So the kind of stress and signs that children might show is preschoolers may show thumb sucking, bedwetting, clinging to parents. They could have sleep disturbances, loss of appetite. They may also regress to childhood behavior. Some preschoolers, they may behave like an infant, cry like an infant. Elementary school children, they may be very irritable, clingy. They may have nightmares. They have poor concentration. They may refuse to engage in family and friends. Adolescents, they may withdraw from other people, they may have conflict with others, physical complaints may also be there, loss of interest. And if these symptoms are there, definitely for 2 weeks, somebody asked a question that, when do we have to show some health professionals, when should we go for treatment for these kind of symptoms? If all these symptoms that we are talking about remains persistently, all the time for 7 days to 2 weeks, all the time, pervading, consistently present, then we have to show a mental health professional. Otherwise, it's normal. It's a normal anxiety to an abnormal situation. But if these symptoms stays from 7 days continuously to 2 weeks maximum, every day, then you have to show to a mental health professional. So what is domestic violence? So domestic violence, as we know, it's any other violence in marriage or cohabitation. When in a relationship or marriage, one or both the partners uses physical, sexual, or psychological violence to try to get the power or control over the other, it is domestic violence. It can occur in heterosexual relationship, in same-sex relationship. It can also involve violence against children, parents, or elderly. The purpose of domestic violence is to gain control or power over the victim. So the forms of domestic violence are physical, sexual, verbal. As I said, physical, it can cause you fear, pain, injury, and other kind of physical suffering or bodily harm. Sexual, using sex in a very exploitative fashion or forcing sex on another person. And sexual abuse may also happen, that is verbal as well as physical behavior. Verbal abuse, the act of forcefully criticizing, insulting, or denouncing another person. It harms the self-concept of the other person and produces negative emotions because the use of abusive language is so threatening, so denigrating, and so embarrassing for the victim that she or he just cannot take it. Emotional abuse is also one kind of domestic violence where any behavior that exploits another person's vulnerability, insecurity, and character by continuously controlling, manipulating, and degrading that person emotionally, not physically, is also domestic violence. There's another violence which comes under domestic violence is economic abuse. It is a form of abuse when one intimate partner has control over the other partner's access to economic resources. It may involve preventing a spouse from resource acquisition. That you don't allow your wife to take, property from somewhere or buy property or object the wife from taking any property from her family, limiting what the victim may use or by otherwise exploiting the economic resources of the victim. This is another kind of domestic violence. So domestic violence cycle is in couples is something like this. It is like a person in the couple, one spouse or the husband and wife. Here, if I'm talking about a man, he may, lure the other person. It is a honeymoon stage where people talk very nicely to the other person, and try to gain the control over the person. When the other person likes him for whatever words he uses, then that person will be brought under his control. So the husband brings the wife under his control by a lot of good messages, very good communication, a lot of lovey-dovey messages and love you and a lot of other things which makes the wife or the partner feels very, very happy. After it is done, what happens? He will try to isolate that, wife or the co-partner from other people. You should not meet your friends because I love you so much. You should not meet your parents so much because it's not required to be always with your parents. It's not required always to be with your friends because I am there for you. In that way, the person will isolate the partner. And after that, what will happen when the other person has completely been detached from other people and she or he is only with this partner, then this person will create some violence, some kind of emotional abuse, sexual abuse, or any kind of abuse will take place. And at that point of time, she has already submitted herself to this partner, right? And it will be very difficult to come out of this trap. So at that point of time, when the abuser, then the abuse, then for some kind of some kind of reconciliation will happen. That, okay, if you do this, and I'm not going to do that. If you do this for me, I'm not going to do that. And then he's going to impose a lot of demand on the partner. Then the partner, when she understands that this is not going to happen anymore, he's trying to use me and tries to retaliate and tries to say something, then the abuser plays a victim card and then blame the victim. And again, this is a cycle that happens, that because you're retaliating, I'm feeling like this, and you're an abuser. And this is a kind of a game that person plays. And it is this way, you don't know how you get into the trap. And when you get into the trap and you feel that there's helplessness and you don't know what to do because you are already in this person's game plan, and then to come out of this whole charmed kind of an atmosphere, this kind of a cycle, is very, very, very difficult for couples, because she had already been distant from anybody and everybody who was special in her life, and she has become a victim to the circumstances, and she has become subordinate to this partner. So many a times, when you are a victim of domestic violence, you really do not know that you are actually being abused, because it is done very differently by partners. And then coming to elderly. In almost all countries, older people are facing the most threats and challenges this time. So more than 50% of all fatalities are involved above 80 years, above 70 years. So older people face a significant risk of developing severe illness if they contract disease due to physiological changes that come with aging and potential underlying health conditions. We have to understand that elderly people already are physically ill people because they are weak, and their immune system also is compromised. So because of that, it is a risk for them to meet people, to go out, and people also are not allowed to go and be with elderly people because of the different kind of vulnerability factors. So at this point of time, what happens? They feel really isolated. And when they elderly people always wants to be with others, they are social, they want to be in groups, they want to be with family. And this kind of isolation definitely leads to a lot of anxiety and depression. So during times of isolation and quarantine, older people need safe access to nutritious food, basic supplies, money, medicine. And this is very easy to be done in India, because India is a kind of a, we are a family oriented country. It's not very, we are not individualistic so much. It is, think about, America and US and UK and Europe, what is happening there? Because the elderly people are all left by themselves alone. So most of them are dying because of that, because they are not getting nutritious food, they are not getting the basic supplies, and they are actually not being able, not going for their own health checkup because they are so old, they cannot go alone. Many things. The health support system is only the government, and family is not always with them. So most of them are dying because of that. But in India, we are always with family. Family takes care of the old people. Old age homes concept is very new in India. So what is happening is that, people, old people are getting a lot of respite, and people are taking care of the old people. Still, the damage is definitely there, and we are becoming an individualistic society, and we are definitely Western minded nowadays. So because of that, old people will definitely suffer in India also, but less comparatively to the Western world. So mental health during anxious times is also a key consideration for the old people, and they should be respected. They should be treated with dignity. That should happen, because many a times what people are doing is that, they are telling their younger children that don't go near your parents, don't go near your grandparents. The way they are saying, the children are also not understanding why. Children are like shocked. Suddenly we are not allowed to go to our grandparents. Why? Because we love to be with our grandparents, and suddenly the people are saying do not go, and it's like a stigma for them. It's kind of discrimination for them. So we should know how we talk also. So what is the management of these psychosocial issues across generations? What's important is how will you talk about the risk of the infection to children? Talk to children in a very calm and assured tone. Introduce COVID-19 as a kind of flu, as a kind of a germ theory that we do. What is flu, what is a germ theory. Do not scare them with literal facts because they will not understand. What your language should be very much correct information, and the language that you use should be age appropriate, because for a 5-year-old you cannot speak the same language that you speak for a 10-year-old or a 14-year-old child. So you need to know what kind of communication you need to have with the children. Hand washing, physical distancing, all these are always important. People are talking about all these. So how you can demonstrate? So some of the examples that I want to give right now is, help children simply understand the basic concept of disease and the prevention and control, like how germs can spread. For example, by putting colored water in a spray bottle and spraying over a piece of white paper, observe how far the droplets travel. When you put a drop in a paper, how it gets smudged, the whole paper in no time. So make them understand that the disease of this COVID is something like that. So it just kind of moments may it can spread. So it's just like the droplets in the water droplets in the paper. So demonstrate why it is important to wash hands for 20 seconds with soap and water. So then put a small amount of glitter in students' hands. Like, you can put a little amount of glitter in a child's hand and have them wash them with just water. Notice how much glitter remains and have them wash for 20 seconds with soap and water. Then they will understand the difference between just washing with plain water and washing with soap water. Have students analyze the situation to identify the high-risk behavior and suggest modifying behaviors. You can ask the children, what do you think are the high-risk behavior at this point of time? How will you modify that? What are you going to do for that? Asking children about themselves and how they are going to be safe at this point of time and why it is required. Do not share cups, eating utensils, foods, or drinks with others. So you should tell them and why and what is the reason for saying that. Again, giving the same kind of examples that I have given. Focus on good health behavior such as covering cough, sneezes with the elbow and washing hands. Those are why important. Again, you have to give explanations, and always give reassurance that adults are there to help you, keep you healthy, and take care of them if they get stuck somewhere. Why it is important is to reassure the children all the time, to make them feel safe. Children are very fearful at this point of time because they are not understanding why so much of precautions. So you should make them understand that we are there for you, you are safe in our hands. So give some examples about how adults are working for them, how to keep them safe. So positive reinforcement always should be given. Whenever the child washes hands, you should say, very good, you washed your hands. You should thumbs up and, give a star on the star charting or something like that. Give positive reinforcement most of the times. Social reinforcement, good, very good. Touch, pat, kissing. Touch is important for young children. Though we do not give touch for our elder people, but with children, we can definitely touch them and say very good and hug them and kiss them and all. So upper elementary and early middle school children, you should be more vocal and verbal in asking questions about whether they indeed are safe, what will happen if COVID-19 spreads in the area, what will they do. So they are very curious to know about the facts. So provide the basic facts and what is research going on till now. But we cannot conclude all facts at this point of time because research is going on and will take some time to come to some kind of conclusion. They may need assistance separating reality from humor and fantasy. So you have to make them understand what is real and what is fantasy and what is a humor, because they will not know. Everything will be so diluted because a lot of messages they are getting from different kind of social networking sites. Try to normalize and do not magnify the issues and make it very, very big for them. And issues can be discussed in more depth with high school students. Elaborate the discussions with consensus, refer them to appropriate sources of COVID-19, provide honest, accurate, and factual information to them, and sometimes use them also in the decision making about the family plans, scheduling, and also asking them, okay, tell us who is going to do what in the family. Ask the children to make plans for delegating the task among the family members. Okay, tell us what do you want your father to do? Tell us, what do you want your mother to do? What will you do? And what do you want every one of us to do together? So joint activities, how can we do certain joint activities as a family together? So encourage them to verbalize their thoughts and feelings and be a very good listener. So many a times we talk a lot, but we listen very less. So be a very good listener to the young minds. That helps. So how to deal with anxiety? Help to express feelings and normalize the feeling by discussing the proper fact, acknowledge and show understanding of child's concern, avoid being judgmental. Do not judge and label a child. When the child says, Ma, I saw this today and I think it is something which is very huge and I really don't know. I feel that person is going to really hurt me or kill me, or he's wearing something like this and he's wearing gloves and he's wearing a lot of headgear. I don't know what is going to happen. And then that means what? The child is fearful. But you should not say, oh my God, you're so fearful about this. It is nothing. You should not label that it is fear. You should speak in a very different language. Oh, is it like that? How are you feeling? You tell me about your feelings. Tell me about your thoughts. What does it mean by that? Why is he wearing that? What do you think about it? Something like that. But don't say that, oh, you're fearful. Don't be fearful. If you label that emotion as fear, then the child will definitely get fearful about it. So in that way, do not label emotions of children by giving all those psychological terms. So don't be judgmental, because we are not judges here. We are trying to understand the feelings of the child. So as psychologists, as mental health professionals, if some of you are, I am suggesting that, deal with the children in that manner. Be very relaxed. And if they are having some kind of, fear sensations or anxiety sensations, start deep breathing exercises immediately. And always coach to practice positive self-talk. Nothing is going to happen, everything is fine. There is something, a disease that has come, and this disease is going to go away from the society very soon. People are working very hard and nothing is going to happen. We are not going to die. So ensure some kind of realistic kind of comments. So a lot of things are to deal with the worry about the loved ones, psychological availability of parents. It is very, very important to discuss about favorite memory, discussing events of old family album, reliving the moments that you had gone, we have come across in life, living with those moments, discussing about different kind of positive things that we had done to each other in different times in life. Probably we had no time to talk about all those. So engaging children in creative work, helping them make the bed, clean the dish together, some joint activities. And many times it is always very, helpful to discuss about some fun facts about family, about things that you never knew about your parents. To discuss about that. How did your parents meet each other? How did their relationship happen? And what are the good things about them, together as a couple before you were born? Those kind of things that you can talk about. And always remember, it is very essential to write what you're going through during this pandemic, because like how we are doing different kind of activities, every day is a new day for me. Like, when I was in the webinar and I was talking, I was here listening to Dr. Virinchi Sharma, there were two calls, one from the ADGP Assam police, another from the superintendent of Borpata Medical College. Both of them had called me and said, ma'am, there is a person who is so and so and he's suicidal. He needs help. Now I said, can I wait till the webinar is over? He said, yeah, you can wait, because he needed some money and we had put the money in his account right now, but he needs help because he says that he wants to die. And then another person, I said, the superintendent, he calls me up, he gave me in my messages 3 people that are there right now. After this webinar, I'm going to call up. And he said that these are the 3 people, ma'am, they're very restless and they're saying they're going to run away from the quarantine center and they're very anxious. Can you please help right now? I said, after the webinar, can they wait? And he said, yes, definitely, because the doctors are there, but still psychological counseling is required. So you can imagine the kind of, impact the persons are having, and the psychological, the necessity of psychological intervention every day and every moment these days. And the profession is getting that kind of a demand, which was never there before. In some ways, people are realizing that the mind really matters. These kind of pandemic, we never thought that the psychological help this extent is required. At every moment we have to be on our toes. So I think we are doing a great service. So we need to have gratitude exercise. So make a list of things where you should be grateful to the Lord for what you are doing in this world. So in that way, place a jar with different activities, ask them to take and do things. making and restoring child's routine, which he has already said. I'm not going in detail, but something he has not said. You may try about having picnics with the children and doing things together. Why women tolerate domestic violence? Why do we actually tolerate domestic violence? First is, which I told you, we really do not know why and how we are in the trap in domestic violence cycle. And when we are in the trap already, it is too late, because we are so disconnected with our friends and family that the person gets a hold upon us. We sometimes feel that we are working too much outside home, so he can say or she can say anything to us, because it's a compensation for the jobs that that person has allowed us to do outside our home. So these are the gender roles that we think that before we used to think that only men used to abuse women. Nowadays women also abuse, and not nowadays, from a long time women also abuse men. So it is a it's not about a role reversal that is happening, because people are becoming equal in earning, in being together. So I think this role reversals is happening. So domestic violence is happening from both sides nowadays. There's a lot of time denial that when I ask a woman, have you ever been abused by your husband? And she said, no, never. This has never happened in my life. And because people deny, and they, out of shame, out of respect to the partner, they do not even accept that they are in an abusive relationship. And that becomes a big threat, because by the time that a woman comes to me, she's already depressed, she's already suicidal. So it is always important to deal the issue in the initial nascent stage, so that tomorrow you do not become a victim of domestic violence and be in a threat and you do not know what to do. Sometimes what happens is you also tolerate domestic violence because of the future of your children, and it's a threat. Because women, if they are not earning, if they are not doing any work, and there is no financial security, then it is the children's future for which they live with their husbands, thinking that it will be a threat for them if they leave the husband, because how will they survive alone in this world if there is no support system, because of the economic reasons. Sometimes there's a death threat by the abuser, like if you say this, I'm going to kill you, or I'm going to kill your child, something like that. So many a times women think that there is a hope for change. Probably after 1 year he's going to change, probably after I have a second child he's going to change, probably when the children will become an adolescent he's going to change. So the hoping for change, so they keep tolerating the domestic violence. So according to National Family Health Survey, 30% of women suffer from domestic violence, out of which 30% is physical, 30% is husband, 8% is sexual, and only 14% sought help to stop it. So you can imagine only 14% has help. And many countries have reported that domestic violence against women across the world have increased by 30% since the lockdown. That means if it was 30% here, in 2016, Family Health Survey, and 30% is increased since the lockdown, then 60% will be domestic violence, which is quite high in, rate to have at this point of time. So it is very, very scary, because the women do not know whom to come, whom to say, whom to talk about their stress. Fear, depression, increased risk of suicide. So reasons for surge. Why is this happening? The crisis situation often precipitates greater domestic violence. Why? Right. It is because certain earlier issues gets aggravated. Many times over the phone, when I had counseling to different people during these 2 months, I saw lot many people had problems from before, and they were actually not dealing with these issues before the lockdown. And when there is a lockdown right now, they have immense time to be with each other and know that these earlier issues are getting aggravated, because they have nothing else to talk about, and they are in conflict all the time, because the earlier past incidents crept up, and they said that why did you do this, and that led to a lot of violence. And many times people are thinking that when the lockdown will be over, we are going to the family court. That's the first thing that we are going to do. Stress, frustration, displacement of anger. Many times what is happening is, if I am angry, I'm displacing all my anger on the other person, because there is nobody else in order to show my anger and frustration, because of job loss, because of the growing economic problems, because of the whole scenario. We take each other for granted. So when we take each other for granted in the family atmosphere, what happens is that I show my anger to the person whom I love and whom I feel intimate about, because he or she is not going to actually retaliate, or he or she is not going to say that I am somebody alien, because he knows me very well and he will take me, and we take each other for granted. So that is why displacement of anger is happening. unemployment, uncertainty, spending more time together, reduce access to basic resources. These are some of the frustrating situations. So prevention of domestic violence can happen in 3 levels. First is we need to give some counseling centers in different places, and counseling centers should be in various places which is reachable for the people, the women. It may be in a shopping mall. It could be near the cinema hall or anywhere, which is very much reachable for the people. Then they walk through and then you're walking in a counseling center. Online counseling center that we are doing right now is very, 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 very stimulating for us as well as helpful for the other person. So unemployment pension can be given to the women, which is not happening in India, but definitely in some countries they give unemployment pension. Free legal aid, prosecute the perpetrators. And then you have to prosecute the perpetrators very fast in a fast track court, how to deal with that. So there can be zero domestic violence policies. So that is also in the government level. In the societal level, we should stop the stigma, because many times we feel that a woman who is abused is again she gets victimized. Many times people say that she might have done something wrong, or she's a working woman, she goes out with men, and probably because of that the husband has threatened her or abused her, and it's okay, because otherwise also I think she's bound to go through all these. That kind of a stigma that people say about women who are in job and juggling between home and personal life and private life. So reprimanding the abuser again, supporting the victim, facilitating the victim to take a decision. No, we don't actually. We should facilitate the victim to take the decision, educate the female children with domestic violence. And today I'm educating the female, whoever is female, that this is what the domestic violence cycle is. So if we know that we are in such a cycle, how to come out of that, and we should not be feeling trapped in that cycle. Gender sensitization to all male children is very important. The males should know how to respect the women, and they should know that they do their work by themselves. So in the individual level, breaking the silence is important, because violence thrives only in silence. And so seeking active help. There could be some help codes. I have made the basic guidelines. If you can go to the URL, I think I'll share the URL with Dr. Gomati so that she can share that URL with other people. So there I have written the helping codes, like, if a woman is calling you up and you are in the counselor's role, you are listening on the telephone, and the woman is calling you up for domestic violence, okay, because she has been abused by the husband or the partner, but she cannot tell it over the phone because the partner is just nearby to her. Then there should be some fixed codes, like, you just tell me, are you being abused? Then if she says yes or no, she'll not be able to say it. And if you're abused, tell me what is the time. If you're abused, just tell me this sentence, what is the time, something like that. Or I'm feeling very hot, or I'm feeling something, I'm feeling very hungry, some code of something like that, so that the psychologist understands that this person is being abused and you have to do something about it. Because if the person is hitting her, she'll not be able to tell anybody, this person is hitting me, because he's going to hit her more. So isolate the perpetrator, isolate herself, self-help with pepper spray, red chili powder, have an escape plan ready, do not get trapped in domestic violence, are different kind of languages that you need to use. So domestic violence under any circumstances is not justifiable and reasonable. Elderly need physical care and support, but now it is locked down. Elderly love company, but now it is locked down. So what should we focus upon? Good time to relive memories of bygone years. Give reinforcement to keep distance for their safety. Let them think about going through and organizing old photos, memorabilia together, and enjoy the stories and happy memories they inspire. The grandchildren and children should be reminded that physical distance is not disconnection. So to keep the connection with the elderly population by any means, by video conferencing, by WhatsApp call, in the WhatsApp also, they can talk to their grandparents, in the video calls and all. In isolation, they may break down. So, the seclusion may also enhance their capacity, their vulnerabilities and risk factors more. So it is very important to make some plans, like what are the medications they should take, what are the healthcare providers they should contact, what are the emergency numbers, what are the end of life care options they may have. There are some advanced directives. Sometimes in psychiatry and psychology we have advanced directives. That is, we should give some advanced directives. And if I'm ill, so and so person should be contacted. This is the phone number. So any caretaker and anybody who budges in the old person's home should know that this person has to be contacted for these reasons. So these are called advanced directives. So we should have the phone numbers, and all has to be pasted on the walls on a chart paper so the elderly population can see them and call them up immediately if they are in need of care. So physical safety, taking help of neighbors, and neighbors should be known that there's an old person here and he's all alone or with a helper, whatever you plan to do. Regular supply of essential commodities and medicine for diabetes care, antihypertensive drugs, any kind of mental health medicines, if it is there, antidepressant should not be self-medicated, because if they take anti-anxiolytics, antidepressants, they may kill themselves. So it is better that self-medication is not given. Even if it's given, you should keep one tablet only for them to have every day, something like that. Keep assisting device functional, like hearing aid, glasses, dentures, walking stick, wheelchair. Social company is important, using technology and social media, and the symptoms of distress, as anxiety, depression, and death wish, if it is there, to consult the mental health professionals immediately so that they get care, because elderly suicide rate is very, very high. You should always remember that we should not take the depression in elderly as granted, because we always feel that he's old, he is retired, his children doesn't stay with him, so he has to be depressed. We take it for granted. No, there's nothing like that. Depression is an illness, and depression has to be treated with medication, with psychotherapy, with counseling. So you have to say that, yes, probably he's depressed. Let me check if he has some low feeling, sadness, irritability, sleep is not okay. Then we have to start with some kind of medication probably, and also indulge in certain kind of quality time. So, small routine activities can be given to them. Some recreational activities like puzzles, some board games, Ludo, Carom, or whatever, listening to music, old songs, which they used to always like. Connect to loved ones every day through video call, which I said already. Physical exercises like simple yoga, meditation, simple stretching exercises, cutting down listening to news and seek information from reliable source, because the old people are always in front of the TV. So we should cut that down also. We should know where they are taking the information from, and identify a support system. That is very important. If the old people cannot go to the grocery shop or medicine shop, so the support system should ask the grocery people, the vendors, to give the essentials to their home at one particular day, so that it's on their doorstep and they can just carry them inside their home and prepare their food. So these are certain things and strategies across the generation for children, for domestic violence people as well as old. So supporting and protecting older people living alone in the community is everyone's business. It is not only the family member's business, it is everyone's business. We should know that. So the take home message is, this pandemic is a temporary phase and it is not going to last long. This too shall pass, but only when we react and act responsibly and collaboratively. First priority is physical distance, physical safety. Second priority is restoring the normalcy and quality in daily routine. And we need to normalize our behavior, normalize ourselves in our day-to-day life. And this is the best practice guidelines that we had published. I had been with three authors together with me, and I'll provide with a link. This is written in the if you can see the footnote, best practice guidelines for telepsychology during disasters, and it is published already. I'll give the URL link here. All the different ways of counseling during the pandemic, how to do, what to do, even the counselor's anxiety, how you should do and how you should manage that is written. So if you're interested, you can go through. It is online, it is free. Thank you very much. And this has been a very, very, I think, nice webinar to present with, because a lot of students here, and it's a mixed crowd, I believe. And I would love to have some questions if you have any. Thank you very much, Dr. Gomati and all others present here. Thank you.
Yes. Excellent presentation, ma'am.
Yeah.
Thank you, ma'am, for enhancing our knowledge on COVID-19 pandemic and its psychological impact on individuals. It was an inspiring and valuable presentation. The case studies and the information how to handle children gave a clear picture of the effect of anxiety and depression, and you also dealt with the solutions to it. It is a marathon and not a sprint. I now request Dr. Jarna to take over the questionnaire session. Dr. Jarna.
Thank you, madam. Good afternoon, madam. Madam, as Dr. Gomati said, it was really an excellent session. And in fact, I have no words to praise you, ma'am. You have covered so many aspects, ma'am. You spoke about migrants. That was really a pathetic situation our people have faced in this COVID season. And Madam, you have also shared your research information with us. We are really thankful for that. And you spoke about stress, anxiety, and depression being equal across the globe. And ma'am, the very important thing is you said that we need to seek a medical advice when symptoms are noticed. Ma'am, I think this will really help to prevent more frequency of suicides. And you have given differences between signs and symptoms of stress at different age groups, ma'am. And you have also covered on domestic violence and how to care elderly particularly. And you have covered even yoga, use of yoga and meditation. That was really, ma'am, a full pack lecture. And we have so many compliments and gratitude for you in our share box. Madam, we have some queries from our very enthusiastic participants, especially ma'am from student. I would like to read this as it is, ma'am, so that it will be very clear for you. Exams are postponed and I am worried about forthcoming entrances. Sometimes I'm feeling low thinking all about it and sometimes misbehaving with my family members. Hope could I get how could I get out of this? May I
Okay.
repeat, ma'am?
No, I got it.
Okay, thank
No,
you.
she is feeling very guilty about, responding negatively to her family members. I would say that it's okay. Sometimes to behave negatively, to retaliate is all right, but it should not happen all the time. All right. So you should understand how to control your negative emotions and, self-regulate yourselves. That is very important to understand because our emotions should be always in our control. Okay. And we always take our family members for granted. So what happens is, my parents will understand if I shout with her at her, and they also feel depressed because you are in a very, very distressing situation. And the parents will see the distress in you and they will also get depressed. So it is a depression is going to get generalized from you to your parents, and it is going to be a cycle kind of a thing. So what you need to do is see at this point of time, we understand, as teachers, as professionals, what you people are going through. I have also spoken to different educators, so what do you think we should advise the youngsters? This phase, as I said, is going to really pass, but definite change is going to happen. So you be prepared for any kind of change. You just be equipped to deal with any kind of situation because life is all about changes. You need to adapt to different kind of methods of learning, like this online education. See, it has become so easy for us to reach out to each other, right? I wouldn't have known Dr. Gomati, I wouldn't have known Dr. Charna, or I wouldn't have known anyone here, isn't it? Only because of this webinar, they know me, what kind of work we are doing in Assam, I could present. And I very proudly am presenting our Assam model. I'm again telling you, I haven't shared this. Just 2 days back, the government of Assam, the health and family welfare minister, he is Himanta Biswa Sharma. He had given me, along with me, some colleagues of mine, the responsibility to start Assam Mental Health Task Force, where we are calling up the people by ourselves, the COVID-19 patients by ourselves. 220 people are there. We are all in the web, okay, in the portal. Through 104, we are calling each and every individual of COVID-19 patients and doing counseling, which is never done in any of the states in India. Okay, people are all having helpline, and helplines are there. People can call the helplines, but it's not this. We are calling the people. We are not waiting for them to call us. That is what is very important because we don't know whether we are depressed. We don't know we are anxious or not. See, this girl who has written to us right now, she is definitely anxious. She is definitely very sad and low. She needs somebody to talk to. So now she has got an opportunity, she's asking questions, right? But if somebody would have called her up and asked her, how do you feel now? Your exam is not happening, your career is in jeopardy. How do you feel about it? And then she says, yes, I'm feeling sad, I'm distressed, I'm very irritable. Then I would suggest that please go and speak to a professional. You might need medicines also. The same goes to her today. If you are very irritable, your negative control, your negative emotions are not under your control, please talk to a psychologist, please talk to a psychiatrist. Medicines may help you because you are probably very anxious. Okay. And also remember, that every challenge should be taken as an opportunity. This is a challenge. And in this challenge, how you can change into certain opportunities to learn new things in online, to do certain things differently, start learning. Okay, and this definitely will pass. And if you have anything to ask me individually, I have my number, I've given my number, I have my email, everyone can be given my email, and you can contact with me individually also. And I can connect to you to some kind of mental health professionals if you want to see them face to face, anywhere you are.
Thank you, ma'am. I think well said, ma'am. You said life is all about change. And I think change is the law of nature and we need to adapt to it. Ma'am, I would like to move to the next query.
Yeah.
During lockdown, we are all frustrated. How to overcome this?
I've already said how to overcome. It's about overcoming. It is about facing it. Okay.
Yes.
After we face it, as Dr. Birinchi had said, we learn to become helpless. Probably we'll learn to get adapted to this phenomenon. You know, now that we are already getting adapted to it, we are already overcoming it. See, you people are in the webinar learning new things. You're trying to overcome it, right? You've got some new knowledge today, and you need to replace your old set of thinking with new set of thinking. You know, that is called cognitive restructuring. How you can change your way of thinking. You know, if you can change, like how you see a half glass of water, right? Half full or half empty. So in the same manner, you just change your way of thinking. That this is a time where we can get along with people from abroad, from webinars are happening. We are getting along with our family members. We are all together. We would have never got such a time. You know, never we had got such a time to quality time with our family members, spending and knowing each other. Sometimes we didn't even know our parents, you know. Sometimes we wondered, you know, now we wonder, oh my God, my mother is like this also. She, you know, certain new things you will see in your parents, in your family members, which you would have never known, and probably you are blessed for that. So, and also think that how blessing, you know, the grateful you should be to the God that we are. See, we are people who are talking, we are people who are eating well, we are sleeping well. Think about the people who are not even getting the chance. You know, the migrant workers, the people who are not having all these webinar and high elite class of technologies, how they are surviving. Have you seen those people who are, you know, carrying the handicapped people in the bicycles and going, you know, the handicapped person who cannot cannot walk, people are cycling them and putting them in front of their cycle and riding the cycle to bring that handicapped person home. So this is how people are taking it as a challenge and coming home to be with their family members. So we are with our family members. That is the greatest blessing, and I think that is the greatest way of doing and dealing with things at this point of time. So do not get disheartened. Think positive. If you think positive, your emotions will be positive, and your emotions will be positive. You'll behave positively and be with people.
Thank you, ma'am. I think you well said that it's now time to become more patient and humane, in fact, so that we can help each other in this situation.
Yes.
Ma'am, may I have one more query, ma'am? This is regarding sleep, ma'am. Any tips to sleep such that we wake up with a relaxed mind? Any tips to sleep such that you wake up relaxed?
Yeah, it is very important to sleep without the mobile in your bed. Okay. Mobile should be out of your sight before going to sleep. There should not be any such conversation which is taxing to your mind. If about career, if about your studies, it's something to do with the coronavirus, never do that. From evening to not have coffee, tea, whoever is having sleep problem, caffeine should be avoided. You should have very light music, and don't go to bed if you do not feel sleepy. Avoid the bed till you are sleepy. Be on the chair, just go for a walk, do something, but do not be on the bed and toss and turn on the bed. Bed should be avoided even in the afternoon. People who are having sleep deprivation problem, avoid the bedroom and the bed as much as possible. Have food, nutritious food, but don't overeat at night. Have light food and do relaxation exercises. Some deep breathing exercises or mindfulness based. You can download mindfulness based stress reduction from the internet, and MBSR, that is a website, and you can go to that and see the videos also. You can see in YouTube and then listen to that and then do the relaxation and go to sleep. And avoid talking to friends and people after 10 o'clock or 10:30, and make a routine. It will be very, very difficult to set a routine because your habitually our routine is set. So you have to learn to unlearn your old habits and learn some new habits. Okay.
Thank you, ma'am, for giving us such useful tips. I have, in fact, no words to praise you, ma'am. Once again,
Thank you
thank you
so
for
much.
giving us
Thank you
such
so
an
much.
excellent session, ma'am.
Thank you
Over
for
to you.
providing this opportunity, all of you, because with Hyderabad students and all, I wouldn't have got an opportunity like this, right? So yeah, so I'm so very thankful. I was in Bangalore for quite a long time. I mean to say for my MPhil, and I know all the people who are from South. I think you all do a lot of work for the society, and you are having helplines also at this point of time, right?
Yes,
Are you having from your school certain helplines in
yes, ma'am.
psychological cases?
We do have. Most of our institutions, we have cells particularly for
Okay.
overcoming the psychological. We do
So
have
do
a
you have
psychological aspects.
counselors,
Yes,
designated
ma'am.
counselors?
Yes, ma'am. We
Yes,
have
ma'am.
a
We do
counselor,
have.
psychologist in the college who can help children, who
Okay.
students at
All
distress.
right.
We have
Yeah.
a
So
department of psychology as well, ma'am.
yeah, so you can ask that counselor to do some survey. You know, some survey scales can be given.
Yes, ma'am.
Even that scale that is there in my book, you know, that scale also can be randomly given to everybody, and the name should not be written. And then
Yes, ma'am.
from your school, you can do a survey and see the stress and anxiety among the students as well the parents of these students.
Yes, ma'am. We understand.
Okay?
In case of research, the names should not be
Yeah,
disclosed, as it is a
yeah,
very sensitive subject
yeah, yeah.
and a very challenging also, ma'am.
Yeah, then you can get an idea na, how to, you know, focus and what to focus probably in your school also. This is my, I think is a suggestion outright I give.
Yes, ma'am. Ma'am, yes,
Because,
ma'am. Ours is a college, ma'am. We do have
yeah, college. I
schools
mean to say
also. We
college.
do have both in our campus. We have school, college, and
Hey,
also
college me, what you
yes.
can do, tomorrow I have a drug abuse webinar with IGP and DGP Assam Police. It's on drug abuse and drugs challenges. You know,
Okay, ma'am.
the substance use disorders is huge among adolescents and among college goers because it's very huge, even
Yes, ma'am. You're
cannabis and
right.
other stuff.
Yes.
So I think, you know, certain these kind of studies you can do during this COVID-19 pandemic. If you need any help from me, I can be of help because my Florida grant, USA, is on substance abuse. And I'm doing on the thinking and cognition and planning and executive functioning of substance abusers.
Ma'am.
Because some
Thank you,
children
ma'am.
are very intelligent, but they don't do well because they are having substances like tobacco, alcohol, and all, you
Yes,
know,
ma'am.
and that creates a lot of difficulties in studies.
Yes,
Ma'am,
ma'am.
it's a really, ma'am, very interesting, ma'am. You have a very good ideas, and we'll be happy to collaborate with you. And definitely, the suggestions given by you will be considered, ma'am.
Yeah,
And
thank you
we
so
are
much.
looking forward for a future input also from you. Thank you once again. Over to Dr.
Thank you.
Gomati.
Thank you, Dr. Jarna. Once again, thank you, ma'am, for giving clarification and also for your most valuable and lucid presentation. We are all on the sea of life. Sometimes waters are calm, sometimes a bit choppy or stormy. Be mindful
In understanding the psychological impact of COVID-19 and for the fruitful interaction with the participants. Friends, lockdown is highly impactful and may result in stress, traumatic reactions. I'm sure today's lectures delivered by experts, particularly on mental health promotion, offers the opportunity to build the skills, services, and environments that support good mental health. This enables people, organizations, and communities to realize more of their potential, flourish, and improves outcomes which may contribute to a greater sense of satisfaction and well-being in our lives. Once again, I thank our guest speakers for giving us valuable time from their hectic schedules and making today's webinar sessions excellent. I thank all the participants for their active participation and cooperation. I'm sure that this webinar was beneficial in updating their knowledge and also prepared all of us to face this pandemic situation. I sincerely thank our college management principal and vice principal for their constant encouragement and continuous support for conducting these events. I also thank the staff, faculty, and students of LFDC for their kind help and cooperation in organizing the webinar. Finally, on behalf of Department of Zoology LFTC and also on behalf of Sonapur College, Sonapur, Assam, I once again thank everyone whose contribution has made this national webinar a grand success. Thank you one and all. Have a nice day. Over to Dr. Gomati.
Thank you, Dr. Jarna. Well, ladies and gentlemen, that wraps up our afternoon. On behalf of LFDC, I thank you all for making time in your busy schedule to join us here this afternoon. Organizing such a webinar requires contribution from all quarters. This national seminar enjoys the special support of our principal, Reverend Brother Vincent Reddy, Vice Principal Mrs. Jayanti Reddy, and a dedicated computer science faculty, Mr. Vijay and Mr. Raman, who were always there to ensure that the events were executed with precision and quality. I thank Dr. Devabrot Khanikor, Principal Sonapur College, Sonapur, Assam, who had collaborated for a noble cause to fight against anxiety and depression. I express our deep sense of gratitude towards our esteemed speakers for their wonderful session. Last but not the least, I appreciate my colleague Dr. Jarna, who shouldered me tirelessly throughout this journey in making this webinar a grand success. I had to mention and appreciate with whole heart our technical help rendered by our BZC students Sai Charan throughout this program. It has been a pleasure to host this event. Sometimes we are tested not to show our weakness but to discover our strength. Together, we can survive the COVID-19 crisis and live well. Find joy in simple things, as even a wee smile a day can make a big difference. Stay safe and healthy. And it's Dr. Gomati signing off for today. And for the participants, in the chat box, you can find the link for the feedback form. Please fill the feedback form and submit to get the e-certificate. Thank you for the evening.